There's 38 million Americans that suffer migraine headaches. With so many people dealing with this issue, finding a treatment for your migraine headaches can feel overwhelming or even exacerbating. So it's not a surprise that you might start to feel a little lost as you try to figure out what's right for you or what'll actually work when you're in pain. There are many therapy options for patients with migraines that have expanded over the last couple years, with several actually new medications that are specific to this disorder. The first one being Rayvow. Rayvow is a medication to treat migraine attacks and provide pain relief within 2 hours. Rayvow also does not appear to constrict the blood vessels, making it a potentially better option for patients with a higher risk of strokes and heart attacks. The second one is Nurtec. Nurtec is a fast-dissolving oral migraine treatment that has a similar mechanism of action to Ubrelvy. Trials show that more patients taking Nurtec experience relief in 60 minutes, 2 hours, and over the next 48 hours compared to placebo. The last new medication for migraines is Ubrelvy. Ubrelvy is another migraine medication to treat migraine attacks that provides relief within 2 hours. And this one blocks CGRP, which is a specific protein that is thought to contribute to migraine attacks. Ubrelvy has also become very popular in the last couple of years because Serena Williams, a very famous, as you know, athlete, is currently taking Ubrelvy and is getting relief from that medication as well. Unlike many medications that fall into the biological medications that treat migraines, Ubrelvy is unique because prevents migraines and is taken to break a single headache. So as you see, there are many prescription medications that help prevent migraines, and they treat the symptoms once they start. In addition, physicians sometimes recommend lifestyle changes such as dimming the lights or reducing stress. And they also urge patients to take over-the-counter prescription strengths such as ibuprofen to manage the pain. Some even recommend Botox injections to reduce the frequency and symptoms of their migraines. However, given all this information, sometimes these medications still might not work for some patients. And this is where I think that pharmaceutical compounding can really be of great use. Compounding pharmacies can make customized therapies that might contain higher strengths than what's commercially available for migraines and headaches, or they can combine 2 or 3 different active ingredients that have been proven to help for migraines and headaches. And these can be usually put into a sublingual troche, or they can put into a nasal solution. Many patients that experience a migraine, the first thing that they'll do is obviously try to seek treatment to feel better and to treat that migraine. But it's very important to know where is that migraine originating from and what is the root cause of that migraine. Oftentimes it could be hormones. So balancing your hormones is actually treating the root cause of the problem, and you will experience perhaps less migraines down the line. So with all of these options out there, compounding pharmacists can work closely with the patient's doctor in order to find the best formula for them. For example, one of our top formulas that we use for migraine patients that are not getting relief from commercially available products would contain piroxicam 40 mg, prochlorperazine 4 mg, and caffeine 75 mg. And this is put into a sublingual troche that is natural, called a natotroche. This does not contain any polyethylene glycol or dyes, and a lot of patients love this more natural alternative. A sublingual troche is a mold that is made at a compounding pharmacy that is placed under the tongue, and it dissolves in about 10 minutes and is absorbed into the system using the subbuccal route. Most patients will use one of these sublingual troches at the onset of their migraine, and if needed, will use one a couple hours after that. So sublingual troches can be a faster alternative for patients that are looking for faster relief. We also offer nasal sprays, and many patients like that they can take their nasal sprays, they can carry it with them, and they can just do their customized per patient nasal spray that's made for them by a compounding pharmacy and get relief very quickly.